Hello, everyone, and welcome again to another Max Doc Talk. Joining us today is Dr. Kanika Batra Modi, gynecological oncology consultant here at Department of Surgical Oncology at Max Super Specialty Hospital, Saket. Hello, doctor.
Hi.
So, doctor, today's topic is understanding cervical cancer, and as I believe, cervical cancer is one of the leading causes of cancer in women in our country.
Yes. So basically, cervix is the lower part of the uterus. That organ is called the cervix, and cervical cancer is the second most important cause of cancer in women, with about 16.2 women affected by it in India. Talking about the incidence, how frequently it occurs in India, about 1.3 lakh women are affected by it on an annual basis. And इसमें से तकरीबन 67,000 women die of the disease every year.
So, doctor, now that we know about how frequent it is in the Indian population, many times people don't understand what exactly does the terminology cervical cancer mean. Cervical cancer जब हम सुनते हैं तो कौन से बॉडी पार्ट में होता है, किधर होता है, सिर्फ इज इट अ विमेन ओनली? So there's a lot of confusion when it comes to the cancer. So if you could just explain to our audience what exactly is cervical cancer.
So exactly talking about it, cervix is basically a part of women only. It doesn't happen in men. और ये जो यूट्रस का लोअर पार्ट होता है that opens into the vagina, that part is called the cervix. That exact orientation is what is called cervix, the lower part of the uterus when it opens into the vagina. That part is called the cervix, and a cancer of that part is called cervical cancer.
Thank you so much, doctor. Doctor, now coming back to understanding cervical cancer, what are the signs and symptoms that usually are normal early warning symptoms and alert red flag that one should look out for?
Yeah, so the signs and symptoms of cervical cancer, it include in a reproductive age group, any woman जिसको bleeding की problem हो रही है, intermenstrual bleeding or vaginal discharge, foul smelling discharge. So not all discharge is cancerous, but these are some signs and symptoms of cervical cancer, and you need to go show your doctor to rule out anything. So any abnormal bleeding, intermenstrual bleeding, especially post-coital bleeding, which means after a sexual activity, अगर किसी औरत को bleeding हो रही है, that needs to be checked up by a doctor. Then apart from that, a lower backache which is persisting, sometimes advanced cases of cervical cancer, they present like that. So if you have any of these symptoms of abnormal bleeding हो रही है, abnormal discharge हो रहा है, post sexual activity आपको bleeding हो रही है, chronic back pain along with all these things, please go get yourself checked.
Doctor, one thing now we are asking about people getting checked. So how does people get early diagnosis and what are the screening options available?
So getting an early diagnosis and screening, we are very fortunate कि cervical cancer एक ऐसा cancer है जिसके अंदर की screening modalities are very good. Before cervical cancer develops, we have got modalities जिससे कि हमें pre-cancerous stage पे ही पता चल जाए है कि cervical cancer बनने वाला है. अब ये कैसे होता है? ये एक simple test होता है pap smear. You just go to your gynecologist or any other doctor that you have, physician also for that matter, who is capable of doing a pap smear. You get yourself checked up. It's a very simple test. It doesn't pain. It is absolutely a very simple and useful test. जिससे कि सर्वाइकल कैंसर से पहले जो प्री कैंसरस कंडीशन होती है, जो कि तकरीबन 10 से 15 साल तक रहती है बिफोर सर्वाइकल कैंसर डेवलप्स, वो पकड़ी जा सकती है. वो अबनॉर्मल सेल्स जो हैं वो पकड़े जा सकते हैं और उसको वहीं पे थामा जा सकता है बिफोर सर्वाइकल कैंसर डेवलप्स. So getting a pap smear done once you're sexually active in your reproductive age group, you should get it done from the age of 21 years every 3 yearly till 30 years, followed by between the age of 30 and 65, you again need to keep getting it done along with another test, HPV virus testing, जो pap smear के साथ ही करी जाती है, HPV virus testing. So that if the previous ones are negative, आप हर 5 साल पे करवा सकते हैं. So this is one very useful modality which can help reduce द इंसिडेंस ऑफ सर्वाइकल कैंसर, मतलब कि सर्वाइकल कैंसर बनेगा ही नहीं अगर उसको जल्दी प्री कैंसरस स्टेज पे पकड़ लिया जाएगा और उसकी ट्रीटमेंट कर दी जाएगी.
So, doctor, my next question is, who are the people who are at risk of cervical cancer?
Yeah. So at risk, basically, cervical cancer is over 99% of the cases are caused by a virus, HPV virus. So HPV virus के जो risk factors हैं वो any woman who's got multiple sexual partners who are affected by HPV, like for sexually transmitted diseases, STDs के साथ जैसे होता है, those viruses can come and affect you. So anybody who's getting that HPV infection through multiple sexual partners, early onset of sexual activity, a younger age with multiple sexual partners, along with that, if somebody smokes or somebody has been using immunosuppressant drugs or has got a disorder which leads their immune system deprived, इम्यूनिटी के जिनके डिसऑर्डर्स होते हैं, सो दिस सब ग्रुप ऑफ विमेन स्पेशली ये एक हायर रिस्क पे होते हैं टू डेवलप सर्वाइकल कैंसर.
Thank you so much, doctor. Doctor, like you said, that there are tests that you can do. There's HPV test, there's pap smear test. But are there any other prevention? We have heard that there is vaccination also available to protect yourself from cervical cancer. So, what exactly are our options when it comes to preventive measures?
Yeah, so that's basically a wonderful vaccine that we have. एक कैंसर प्रिवेंट करने के लिए वैक्सीन जो कि बहुत अच्छी जिसकी इफेक्टिवनेस है, इट इज़ द HPV वैक्सीन. सो मोस्ट ऑफ द सर्वाइकल कैंसर्स आर कॉज्ड बाय दिस वायरस, HPV वायरस, और इस वायरस के लिए हमारे पास वैक्सीन है. सो इवेंचुअली इट विल लीड टू रिडक्शन इन इंसिडेंस ऑफ सर्वाइकल कैंसर. सो कब लगानी चाहिए ये वैक्सीन? वैक्सीन नीड्स टू बी गिवन टू यंग गर्ल्स. 10-11 साल की उम्र पे स्टार्ट होती है ये वैक्सीनेशन. अगर किसी की उम्र 15 साल से कम है तो उनके लिए 2 डोजेस बहुत हैं. 15 साल से ज़्यादा है तो टिपिकली 3 डोजेस लगती हैं उसके अंदर. एंड anybody even after the onset of sexual activity can be given vaccines, but it's not a very recommended thing क्योंकि effectiveness काफ़ी कम हो जाती है once a woman is sexually active. So these vaccines are known to prevent cervical cancer in about 80% cases. पर जिनको वैक्सीन लग भी जाती है उनको भी अपना पैप स्मीयर और HPV टेस्ट करवाना लाइक नॉर्मल पॉपुलेशन ज़रूरी है.
Thank you so much, doctor. Doctor, हमने वैक्सीनेशन के बाद कर ली प्रिवेंशन एंड स्क्रीनिंग, बट व्हेन इट कम्स टू एनी डिजीज और एनी इन्फेक्शन, ट्रीटमेंट इज द मोस्ट इम्पॉर्टेंट पार्ट apart from prevention. So what are the treatment options that are available for cervical cancer?
So fortunately we have very effective measures available for the treatment of cervical cancer. And अगर early stage में cervical cancer detect हो जाता है with a small tumor, it is possible to do a surgery, a radical surgery which can lead to cure. बट मोर ऑफन देन नॉट, बिकॉज वो थोड़ा लेट पता चलता है, तो हम लोग सर्जरी ना करके पेशेंट्स को कीमो और रेडिएशन का कॉम्बिनेशन थेरेपी देते हैं, विच इज़ ऑल्सो क्वाइट इफेक्टिव टू द ट्यून ऑफ 60 to 70% केसेज में वो काफ़ी इफेक्टिव होता है. और अगर किसी की एकदम ही डिस्टेंट स्टेज 4 डिजीज़ है, देन दैट बिकम्स अ चैलेंज एंड हम कुछ पेलिएटिव टाइप ऑफ कीमोथेरेपी ही दे पाते हैं उस सिचुएशन में.
Thank you so much, doctor. Now, doctor, before we go, I'd like to take a pause and let my audience know that in case you guys have any question, you can write it in the comment section and we will get back to you. In case you want to have a conversation with our doctor, you can use the number that is on the screen or the bit.ly link that is in the description. So, doctor, coming back to you, before we leave, cervical cancer we have understood is something that is preventable and it's a major cause of worry in women in our Indian population. So, final words to our audience that you'd like to share.
So the final words that need to go out to women is to first understand what cervical cancer is, know about it, talk about it. It is our responsibility to bring the incidence of cervical cancer down. We know there ऐसी चीज़ें available हैं like a vaccine and a pap test, something so simple जिससे कि cervical cancer जैसी चीज़ prevent हो सकती है. So why not use them and educate everybody around us about it when we have this opportunity. And apart from this, if you have any of the symptoms of cervical cancer, please go get yourself checked by any gynecologist near you. And without that also, you need to keep going to your gynecologist once in every 3 to 5 years to get a regular pap smear done, which is just like, one very effective way through which you can prevent the development of cervical cancer.
Thank you so much, Doctor. This has been extremely informative and helpful, and I am sure my audience today have new views and understanding of cervical cancer. We'll see you in the next one.